I think one of the things that we need to pay more attention to is to make sure that we connect what is going on in the world of shared care and other new initiatives with senior leadership in the health authorities and within government. I think we've reached a place where we can say this work is meaningful, it has proven results, it is growing in numbers and the interest, and it now needs to be shared not with just those people who are currently interested, but the senior leadership in the province who needs to hear about these things so that it can influence how they think about the different priorities that are facing government or health authorities as we move the system forward. Some of what I see happening in shared care is, I think to a lot of folks, is common sense and back to the basics, but we work in a world that is very complex with a lot of technology and a lot of different systems, so it's trying to bridge those things together. So shared care is a piece, acceleration funding is a piece, and as all these pieces start to come together, there's better communication between the providers, there's better input from the patients, and ultimately we're seeing the evidence that there's better results. I think it really starts at the grassroots. I'm a believer that general practice is the gateway into the system, and so I'm very passionate about those initiatives having their roots in a community setting. It's where people live, work, play. I think the interaction that folks have with other parts of the system are often episodic, short-term, but the rest of their lives are spent in communities, and I think there's a role for communities in general to step up and have more ownership of health of communities that supports the professionals that are trying to provide that other component of health. It's dangerous to come in and learn more about shared care because you want to go home and go, why aren't we doing this, why aren't we doing that? And people say, because we're already doing 100 things. I took away a lot of the different little bits of learning. Sometimes it's interesting for me how people got to make the change initiatives work for them. And then I can relate some of the challenges or some of the successes to particular communities in my health authority where, perhaps we can do something similar there. And then we need to make connections between shared care projects and spread some of the good work that we've seen today.